Below is a comprehensive pharmacological monograph, similar to what you'd find in a nursing drug handbook or pharmacology textbook. Terbinafine, Lamisil, 1. Generic name, drug class, brand name, drug forms. Generic name, terbinafine hydrochloride. Brand names, Lamisil, Turbinex, Turbisil, Zabel, Tinasil, varies by region. Drug class, allylamine antifungal agent. Chemical class, synthetic allylamine derivative. Available drug forms, form strength root, use, tablet, 250 milligrams, oral, onychomycosis, tinea infections. Cream, 1%, topical tinea in skin. Gel, 1%, tom protections, topicals, 1%. Topical tinea pedis, cruris, corporis, oral granules, 25 milligrams or 187.5 milligrams packets, oral, tinea capitis. Number 2, definition. Terbinafine is a broad-spectrum antifungal drug effective against dermatophytes, molds, and certain yeasts. It works by disrupting fungal cell membrane synthesis, leading to fungal cell death, fungicidal effect. It is one of the first-line oral agents for nail fungus, onychomycosis, due to high efficacy and good nail penetration. Number 3, mechanism of action, MOA. Terbinafine inhibits the enzyme squalene epoxidase, an essential enzyme in the ergosterol biosynthetic pathway of fungi. Ergosterol is a critical component of the fungal cell membrane. Inhibition leads to decreased ergosterol synthesis, defective fungal cell membrane, accumulation of intracellular squalene, toxic to fungal cells. Result, disruption of membrane integrity and fungal cell death, fungicidal activity. Site of action, fungal cell membrane at squalene epoxidase step. Number 4, pharmacokinetics. Parameter, description, absorption, rapidly absorbed from GI tract. 70% absorbed but only 40% bioavailable, first pass effect. Time to Pmax, 1 to 2 hours after oral dose. Distribution, highly lipophilic, widely distributed to skin, nails, adipose tissue, and sebum. Accumulates in keratinous tissues. Protein binding 99%. Metabolism, hepatic, mainly via CY2C9, CYP1A2, CYP3A4, CYP2C8, CYPC19 to inactive metabolites. Elimination half-life, triphasic, 12H, initial, 200 to 400 H, terminal phase due to tissue binding. Excretion, 70% via urine, metabolites, remainder via feces. Steady state, reached after 10 to 14 days of daily dosing. Number 5, therapeutic uses, clinical applications. 1, dermatophyte, tinea infections. Tinea pedis, athlete's foot. Tinea cruris, jock itch. Tinea corporis, ringworm. Tinea manuum, hand fungus. Tinea capitis, scalp infection, SP in children. 2, onychomycosis, nail infection, effective for both fingernail and toenail infections caused by trichophyton rubrum, T. mentagrophytes, epidermophyton flocosum. 3, cutaneous candidiasis, off-label. 4, pityriasis versicolor, tinea versicolor, off-label topical use. Number 6, indications, FDA-approved indications. Onychomycosis, toenail or fingernail, tinea capitis, tinea pedis skull, cruris corporis, topical. Off-label indications, cutaneous candidiasis, tinea versicolor, fungal keratitis, topical under specialist supervision. Number 7, contraindications, hypersensitivity to terbinafine or any excipient, chronic or active liver disease, contraindicated for oral form, severe renal impairment, CRCL 50 milliliters per min, use cautiously or avoid, history of severe skin reactions to antifungals. 8, before taking this medicine, precautions. Medical precautions, liver function, baseline LFTs required, monitor during therapy, especially 6 weeks. Renal function, monitor if renal impairment suspected. Taste-smell disturbance, may lead to weight loss or depression. Skin reactions, discontinue if rash, blistering, or mucosal lesions occur. Blood dyscrasias rare, monitor for unexplained infection or bruising. Special populations, group recommendation. Pregnancy, Category B, animal studies safe, no controlled human studies. Use only if clearly needed. Lactation, excreted in breast milk, avoid oral form. Topical may be used with caution. Children, safe in 0 to 4 years, oral granules for tinea capitis. Elderly, no major differences, monitor liver kidney function. 9, how to use. Oral tablets, granules. Take 250 milligrams once daily with or without food. Swallow tablet whole with water. For granules, sprinkle on a spoonful of soft, non-acidic food, pudding, mashed potatoes, and swallow immediately. Topical forms. Wash and dry affected area thoroughly. Apply thin layer to affected skin and surrounding area once or twice daily. Continue for 1 to 2 weeks. skin infections, or as prescribed. Wash hands after applying. 10. Dosing information. Indication, adult dose, duration, onychomycosis, toenail, 250 milligrams PO daily, 12 weeks. Onychomycosis, fingernail, 250 milligram PO daily, 6 weeks. Tinea capitis, children, 5 to 10 milligrams per kilos per day, max 250 milligrams per day, 6 weeks. Tinea corporis, topical, apply 1 to 2 grams daily, 1 to 2 weeks. Tinea pedis, topical, apply 1 to 2 grams daily, 1 to 4 weeks. Misdose, overdose. Misdose, take as soon as remembered. Skip if near next dose, do not double. Overdose. Symptoms: headache, nausea, vomiting, epigastric pain, dizziness, rash, urinary frequency. Treatment: symptomatic and supportive care, activated charcoal if early ingestion, maintain hydration. Number 12. Stop or avoid taking terbinafine. If you develop jaundice, dark urine, pale stools, possible liver injury, you experience skin rash, blistering, or mucosal lesions, persistent taste, smell disturbance, depression, or unexplained fatigue occurs. Laboratory tests show elevated liver enzymes. You consume alcohol heavily, increases hepatotoxic risk. 13. Side effects. COM 1%, gastrointestinal, nausea, diarrhea, dyspepsia, abdominal pain. CNS, headache, skin, rash, pruritus, urticaria. Sensory, taste disturbance, dysgeusia, smell disturbance, fatigue. Uncommon, rare. Hepatotoxicity may be severe or fatal. Anemia, leukopenia, neutropenia. Severe cutaneous adverse reactions, SJS, 10. Anxiety, depression, often secondary to taste loss. Hair loss, reversible. Number 14. Vital information for patients. Oral terbinafine can cause serious liver injury. Periodic LFTs are essential. Continue treatment for the full prescribed course even if symptoms improve early. Avoid alcohol and hepatotoxic drugs. It may take several months after stopping therapy for nails to appear normal due to regrowth. Report any yellowing of skin, dark urine, or a severe rash immediately. Number 15. Drug interactions. Drugs that increase terbinafine levels, CYP inhibitors, cimetidine, fluconazole, ketoconazole, amiodarone, clarithromycin. Drugs that decrease terbinafine levels, CYP inducers, rifampin, carbamazepine, phenytoin. Terbinafine may affect warfarin, altered INR, monitor closely. Cyclosporin, reduced plasma levels. Beta blockers, SSRIs, TCAs, increased side effects. Caffeine, reduced clearance, increased effects. Tamoxifen may reduce efficacy, inhibits CYP-D6 activation. Summary table, category, key information, drug class L-alanine antifungal, mechanism, inhibits squalene epoxidase, ergosterol, fungal death. Main uses onychomycosis, tinea infections, contraindications, liver disease, hypersensitivity, key warning, hepatotoxicity. Common side effects, headache, rash, nausea, taste disturbance. Serious side effects, liver failure, severe rash, blood dyscrasias. Monitoring, liver function, CBC if prolonged therapy. Drug interactions, rifampin, cimetidine, fluconazole, warfarin. Thank you. Have a nice day.